Before watching this video, please subscribe to our channel by tapping the red subscribe button so you don't miss any of our future videos. Stuttering is a speech disorder characterized by repetitive or prolonged syllable sounds. Some people also experience tremors or rapid eye movements. It can be very difficult for people listening to understand what a stuttering person is saying. Therefore, it is very important to treat it in order to achieve better communication skills. This speech problem is very common around the world. In America alone, there are about 3 million people who are suffering from this problem. The most affected age groups are young children below the age of 5. There are basically two types of stuttering, developmental and neurogenic. Developmental stuttering is usually experienced by children who are still on the stage of learning and getting used to a language. The process of learning a language can be challenging, especially if they are trying to learn a lot of sounds. The good thing is that development stuttering is usually outgrown by most kids. This means that even if you do not do something about it, kids will find a way to overcome it. Neurogenic stuttering, on the other hand, can be experienced by both children and adults. It usually happens as a result of a trauma or brain injury. This condition prevents the brain from coordinating effectively, especially with the parts associated with speech. If you are suspecting a case of stuttering, you need to consult with a speech-language pathologist. They are the experts when it comes to language and speech problems. Several factors will be considered for the diagnosis. Several speech tests will have to be done. The speech pathologist may also ask the patients about their childhood history and other possible psychological factors involved. Currently, there is no actual cure for stuttering. There are, however, some speech therapies being done to help people overcome the condition. Nevertheless, it will all depend on different factors such as the cause of the problem and the age of the patient. As for children who have the condition, experts recommended different methods to parents. For instance, children should be kept in a very comfortable environment. The child needs to be comfortable with speaking. Children who stutter are usually afraid of communicating with others because of the fear of being bullied, laughed at, or rejected. Therefore, you need to create a good environment where your child can speak freely. Parents should also avoid reacting every time the child stutters. Children are very sensitive even to simple reactions, and negative reactions can make it more difficult for them to cope with the situation. If you are going to react, you need to use positive reinforcement and make the child feel happy when he says a word correctly. You should also not pressure your child. It takes time before children get used to certain words or language. You need to allow time for them to learn things on their own and never force them to instantly speak the way you want them to. You need to listen to the child and allow him to finish his sentences. This will make the child achieve a certain level of satisfaction that will help him overcome the situation more easily. Thanks for watching and have a nice day.